My name is Lisa Haddon, and I'm the director of the AHEC. So we're going to talk to you tonight a little bit about the health career pipeline and what it is. And this is a 4-person TED Talk. So I'm going to start, and I'm going to talk a little bit about the need and why we have a health career pipeline. Sometimes when our communities are facing dire issues, we tend to look outward. We tend to find expertise outside of our communities. We might find somebody that has a lot of experience, or we might even hire a consultant to come in and tell us what we should do. But more frequently, we do have the talent right inside our own communities. If we're willing to grow it and nurture it, we can build our communities from the inside out, not the outside in. Such is the case with the Health Career Pipeline Program. This program is a collaboration between the AHEC and the CMU College of Medicine. The AHEC is a nonprofit 501c3 corporation, so we're a completely separate community-based entity, but we're housed in the College of Medicine. And the mission of the College of Medicine is to train and educate and prepare our future physicians to practice in Michigan's rural or urban underserved areas. So what does that mean? Many of you may not know this, but over 78% of our counties in Michigan have some kind of underserved designation. The two most common are what we call MUA, MUA, medically underserved areas, and the other one is called a HPSA, which is a health professions shortage area. So if you think about that, over 75% of the counties in Michigan have this designation. So what is the definition of a medically underserved area? A medically underserved area means that patients will have to drive probably farther than 30 minutes just to get in to see a primary care physician. And if there's inclement weather or you live up north and it's winter, that's probably going to be 45 to 60 minutes or possibly more just to get in to see your doctor. If you are an established patient of that clinic, it will probably take you 2 or 3 weeks to get in to see the physician. And if you are a new patient, it could possibly take 2 to 3 to 4 months to get into that practice and see your primary care doctor. So that's the definition of a medically underserved area. The definition of a health professions shortage area is a little bit different, but it still is a weighted factoring system. Counties and areas that have a HPSA designation have 25% of the entire population in that area is under the federal poverty level. So sometimes folks don't have the means or resources to get in to see a doctor. 25% of the population is 65 or older, which means they're higher users of the healthcare system and they might have a variety of chronic diseases. It also means that there are 20 infant deaths per 1,000 live births. So that's an indicator that there's a high infant mortality area. And then finally, the indicator is the physician to population ratio is 1 doctor per 3,000 physicians or higher. All those things combined create a really large degree of medical underservice throughout Michigan. To compound this, over 25% of our current workforce of physicians is 60 and over. So that means in the next few years, they're going to be looking to retire and get out of the workforce. So we don't have a looming shortage of healthcare professionals and physicians. It is here. It is real, and it is happening right now. I'm glad you guys are here. The shortage of the healthcare pipeline program then is a response to this issue. It's a call to action, and it's a way to grow our own in our own communities. We are looking inward into our communities and to our youth. We are working with several high schools. We're working with community members. We're working with the College of Medicine at CMU. We're working with parents. We're working with the AHEC, and we're all working together to create this pipeline so we can look inward into our community and identify those youth and 9th and 10th graders that really have a passion and an interest and want to go into a health career. That's what we're looking for. Students that have gifts and talents and skills and really want to embrace the dream of becoming something larger than themselves and contributing back to their community. So our hope is that one day they will decide to come back to the community and practice medicine or nursing or whatever their passion is. That's the goal of the Health Career Pipeline, to keep our students coming back to our communities, because we need you and we need you to practice in these underserved areas.
Okay, so that kind of leads into, Lisa talked about what the mission of the medical school is. So what's the mission of the AHEC? The AHEC, part of our mission is to provide continuing education opportunities to practicing health professionals. We support medical students, physician assistants, any type of student in a health professions while they're out doing their clinical rotations. That's the second part of our mission. And then the third part of our mission is to identify and create pipeline programs for middle high school students that are in the 9th and 10th grade. So just to kind of give you a background about how this program started, we had 2 first-year medical students, Nicholas Cozy and Leonard Verhey, who were impacted as young adults, and that's what led them to pursue a career in a health profession, specifically medical school. And they had this great idea. They wanted to develop a pipeline program, and they just didn't know who's going to help me do this program. So somehow they were connected to the AHEC, because that's part of our mission, and that's what these 2 gentlemen wanted to help not only us meet our mission, but also help support some of the goals of the medical school. So what the purpose of the Health Career Pipeline program is to do is we wanted to develop a pipeline program that was specific to students that lived in rural areas of Michigan, or also an underserved area. That could still be an urban population. We wanted the students to be in 9th or 10th grade, or possibly a student that could be considered a first-generation college student. So for the first year of the program, we said, well, let's keep this program local. So myself and Lisa and Leonard and Nicholas met with high school counselors, health educators, and school principals at the Mount Pleasant High School, Sacred Heart Academy, and also Montebello Schools, which is in Montcalm County, which is a very rural, underserved area of Michigan, but it's only 30 to 35 miles away. So we promoted this program to the professions at the high school, talked to them about the purpose of the program and what we were trying to do, and we asked them to reach out to students or parents that they thought could benefit from participating in this type of program. And what we did is, once we created an application for those high school students, we asked them to also provide a personal statement as to why they think that they needed to be part of this Health Career Pipeline program. Maybe they had a personal experience that they wanted to share, maybe with themselves or a family member. It might have had something to do with something that had happened to someone medically. But why were they passionate about participating in this pipeline program, to learn more about just medicine and the health professions in general? And then the second phase of this program is that those high school students would be paired with a CMU undergraduate student that are in their 10th, I would say a sophomore or a junior at CMU, and those students, those mentors, are enrolled in some type of health program at the university, whether it be biomedical sciences, athletic training, they could be pre-medicine or pre-dentistry, didn't have to be specific to medicine. And those mentors also supplied us with an application, and they provided us with a personal statement about their experience in mentorship type programs and how they think and what value they could bring to mentoring that high school student. So that was about a 3 to 4 month process. And then after that process, I'll hand it off to you guys.
Right, thanks, Lisa and April. So now we're going to talk about the program in general, what we did each week over the course of the 9 or 10 weeks of the program. So the major part of the program was career exploration. And so through that, they had speed career night. So it's kind of like a speed dating night for health careers. So we had multiple different, either students currently in a graduate program or practicing health professions come into the students. And Chioma would want to add on to that.
Yeah, so this, for both Adam and I, we both were working with this program for 2 years. So our first year we learned from the second year students, and now as second year students we took over to lead the program. And so even with the added element of the career speed dating night, what we wanted to do was increase the number of professions that are represented for students to take part in. For example, we had medical students taking part of it, we had social work students, we had physical therapy, we had number of other PA, we had athletic training. So we wanted to really let students know, I think in general this year we've actually had 9 different professions added. So we wanted to really let students know, like, these are the different types of opportunities that you may have to take part in, not just limited to just medicine, but ultimately throughout the spectrum of healthcare.
In addition to the career exploration, we did healthy lifestyles. So through the program, we had MSU Extension come in. So they came in and did nutrition talks. How do you read nutrition labels? What does it mean to eat healthy? And how can you do that with limited supplies? So they loved creating granola balls, energy balls that they made with peanut butter and oats and all that honey. So they spent the afternoon doing that, and they seemed to enjoy that. And not only they get to make something they get to eat, but it's a practical skill they can take home for healthy lifestyles. And we added some new programs as well for the healthy lifestyles this year.
And yes, so even with the healthy lifestyle, we understood the importance of recognizing that even for themselves, if they didn't have, for example, the monetary funds to be able to, purchase the eating out, we wanted to let them know, like, even in your own, cabinet, you can find certain things to bring together, just to be sure that you're not limiting yourself from healthy opportunities in that respect.
We also did meditation this year. So one of the students that I'm first year medical students, she was really into meditation. So they did a guided meditation in the auditorium, just to help with that stress, because stress impacts our health. So that was new this year as well. So not only introducing into different career opportunities or healthy lifestyles, we also did some different aspects of healthcare. So it's not just, like Chioma mentioned, the nurses and doctors. There's a whole wide range of things that affect the healthcare system. So last year we started a health economics game to kind of show them the global impact of how economics can affect healthcare and how sharing is caring and how you can help out those who are less fortunate. In addition, there's also the research side of healthcare. So we toured the Dr. Rosendahl and Dr. Dunbar. We went to the neuroscience lab and they saw experiments, how they use mice to model Alzheimer's or MS, and how they use brain slices to then study how the treatments are working or how it affects the human body. So it's a different side of healthcare. So it's the research side. So they got exposed to that. And Chioma, do you want to add on to the healthcare?
Overall, too, even with the case of the adding into social determinants of health, we wanted to ultimately add into a program we did with Archie Bunker Healthcare. So that program actually was started from the CMU College of Medicine's Diversity Task Force. And for all of us as undergrads or first-year medical students, we did that program as a way to kind of get an experience of what it's like to navigate the healthcare system. So for many of us, as we've already experienced ourselves, trying to collect insurance and trying to make an appointment for the doctor and then trying to get a referral if you needed to go through that route can take a lot of effort. And so we wanted to let the students recognize that that type of thing is a reality that many of our patients are going to face in their own practice. So what we had the students do was we gave them each an identity card that they did not know what their identity was. However, they were tasked to navigate trying to manage their chronic diabetes. And so in doing so, we told them to go ahead and navigate through different regions we had the set up in the College of Medicine. So with their identity cards, they were called to collect insurance. And for some students, they had an easier time than others. So even in doing so, they kind of realized the roundabout way of collecting that type of thing. Ultimately, to having to wait in line for a primary care physician. At the end of the debriefing moment, we asked the students how many people were actually able to get their diabetes controlled, and very minimal students were able to do that. And ultimately, what we wanted to show them in that case is that, for one, there are certain factors that are sometimes out of their own control. that can cause them to not be able to receive the health care. And we wanted to make that an impacted portion of their curriculum this year, was because we wanted to let them know that, despite what someone may look like, at the end of the day, we want people to know that healthcare matters, and we want them to see what patients can experience in their own health, in their own life. So we really felt that that was an added benefit of doing it this year with the program.
In addition to looking at the different aspects of healthcare, we also did hands-on activities with the students. So that's something that every year students love to take blood pressure, listen to heart sounds, and things like that. So for the past 3 years, we've had Michigan Health come in, and they've done different simulations with their mannequins, and they give the students a little stethoscope that they can take home, disposable stethoscope, so they always like to have those wrapped around their necks. So they're walking around the College of Medicine, which is really neat to see. And so we've added to that program, and we did some different things with the simulations. So I don't know if I'm talking that, Chioma.
So yeah, that was really cool too. This year, what we did was we had a injection station. They learned how to do injections, and they practiced on different oranges. And they also were able to practice doing intubation. So if in case anyone's not familiar with that, in case someone has an airway that needs to be suspended, or essentially they're not breathing, we want to teach them how to actually protect someone's airway. And so it was really interesting seeing the students and their mentors working and trying to navigate using just all the different equipment that's required. And, for some students, it was like you can just see the lights in their eyes. We're trying to do that for the first time. And when they finally were able to get the actual scope into the airway and see the air blowing through the lungs, it was like, okay, they finally figured it out. It was really cool. So overall, we definitely did a lot of hands-on, and you can tell the students really enjoyed that aspect of it. But ultimately, too, we also wanted to do clinical skills with students, as Adam spoke about. So we taught them doing an ophthalmoscope and looking at each person's eyes, and just really getting a chance to see what is the hands-on aspect.
In addition to looking in people's eyes, we brought in the audiology students, and they came in and did an ear demonstration as well with a simulator, so they got to see different health careers, audiology, and also the clinical skills of ear exams. April talked about the mentorship program. So it's a dual mentorship tier, pyramid, whatever you want to call it. So the high school students are mentored by the undergraduate students, and those undergraduate students are then mentored by the medical students. So there's 4 total medical students, so 2 second-year students, Chioma and I, and also 2 first-year students, so Jordan Killingworth and Dorothy Wong were the first-year students this year. And so we served as a mentor for those undergraduate students, because as April mentioned as well, those are all pre-health students. So applying to graduate programs can be a daunting task, and there's lots of questions and steps and hoops you have to jump through. And so Chioma and I kind of served as a point person where they can ask us questions. If we didn't know those questions or those answers, we can point them to contacts, because between the two of us, we have lots of different friends in different health careers throughout the country.
And that was also really interesting, too, for the mentors to get a chance to speak with us, separate from having the Monday nights where we would, work with the students, and just to let it be one-on-one with us, because I know a lot of them had different questions and just even different perspectives about trying to navigate the healthcare system. So it was really awesome to really talk with one-on-one with them without having the complexities of the weeks that we had with all each of the programs that we had set up each week.
And then finally, as part of the program, we did personal developments. So each week we had a word. There were 6 words that psychologist, I forget her name off the top of my head, came up with.
Angela Duckworth.
Thank you. She came up with these 6 characteristics that every successful person has. And so each week we would introduce the word. We'd do some kind of activity related to the word. And then they would spend time, the undergraduate and the high school student. The high school student would come up with their own definition of the word. For example, if the word was grit, they'd put their own definition of grit. If it was curiosity, what does curiosity mean to you? And then they would talk with their mentor about a time where they displayed that characteristic. Then next they would talk about how they could improve in that characteristic. So how can they have more grit in their life? How can they have more optimism? And then lastly, they ranked themselves on a scale from 1 to 10 on how much grit they had, how much optimism they thought they had. So after all that was done, they compiled a personal development project. And after the 10-week program, they created a presentation. And that presentation, it was their word that they most identified with or thought they could grow the most with through the course of the 10 weeks. How that relates to a health career. So what does it mean to have optimism in a health career? What does it mean to have grit? What does it mean to have curiosity? And so they give a presentation in front of everyone at the graduation ceremony. And it's pretty amazing to see students who are shy in the beginning just stand up in front of a room of 50 to 70 people and give this presentation, a very personal presentation. And that we gave them more time to work with the personal development project this year.
Yeah, so this year we actually had it as a 10-week program. Last year and the year before was a 9-week program. So this year we want to add more time for students to really work with their mentors and kind of get more of the opportunity to really dive into it. And whether it be PowerPoint or using posters, they were able to use their expressive nature to display what their character word felt was the most relevant to them.
So I guess we're going to wrap up here with our final impact statements. So I had the pleasure of doing this for 3 years now. I was an undergraduate student here at CMU, and I was an undergraduate mentor for the program when it first started in 2015. And so then became a first-year medical student, was a first-year medical student with the Health Careers Pipeline program, and here I am the second year with Chioma with the program. So it's been great to see the program change over the course of the 3 years. We've definitely had lots more hands-on activities the past few years. We've incorporated the social determinants of health, the healthy lifestyles, stress management. So it's been really fun to see that change, and then we've been able to put our own little touch on. Chioma is a very clinical, hands-on skill kind of person. I'm more of the social determinants of health, and we were able to build that into the program and impact these students' lives. So it's been a great opportunity.
And even for myself, I was part of a pipeline program back in Connecticut, and I knew the impact that it had on my life, and especially now as a medical student. So I understood the the reach back and bring forward type of mentality. So I know that this is going to be an amazing program in the future for students, and even for future students coming up after we finish leading it. But I know it's a really great opportunity for them to really see the impact that they're going to make, and I believe that it's something that can never be understated.
And just to conclude things, Lisa and I each had an impact statement that we received from a high school student and a parent, which really speaks to why we developed the program and what we want the students to get out of the program. And I had a student from Sacred Heart, and he emailed me and he said, what I really liked about the pipeline program is that it was hands-on and interactive. I liked that we're doing something different each week, which makes it fun and engaging. My favorite part of the program was being paired up with 2 mentors. Having the 2 mentors made me feel less intimidated, and I looked forward to talking to them each week. They made me feel comfortable, and I liked the fact that they were experienced college students. We talked about our interests, beliefs, school, and sports. It made me start thinking about my future, such as what I want to do for a living and what colleges I may want to go to. And this is from a 9th grade student at Sacred Heart, which, like I said, that really speaks to the mission about why we developed the Health Career Pipeline program. And it's so important that you start thinking about continuing your education beyond high school, but you have to start doing it when you're kind of entering high school. It's very important. So Lisa?
And then for my impact statement, I heard from parents. And I had several parents contact me and say and share with us that this program literally changed their students' lives. It was life-changing for them, and that they have become more focused and committed to education and pursuing their dream for a position in a health career. And we have to say that when we went out to some of these high schools and talked with some of these high school counselors, we said, we want the kids that really have an interest in healthcare. We don't have to have the rock star 4-point students. That's not what we're after. We're after someone who's really interested in going into a health career and helping them on their journey and helping them achieve their goals. And we think the Health Career Pipeline has done that, and it's proven it now for 3 years. So thank you very much, and if you have any questions, we'll be happy to entertain them. Thank you all so much for coming tonight.